Hospice, also referred to as end-of-life care, is a home or hospital setting that is created to support families when a loved one is facing death or an illness. Hospice care dates back to the European Middle Ages when refugees offered a place of rest to travelers. These places of rest were provided by religious leaders known as monks.
One of the most famous facilities is called the Hospice of St. Bernard, which is still open today for many travelers to stop at.
Even though this form of hospice did exist in the 20th century, it wasn't until after World War II when we received modern-day hospice practices in which we treat the ill to keep them comfortable.
Cicely Saunders, the founder of St. Christopher's Hospice in London, initiated the move for hospice care. She thought that the terminally ill patients should be in a place where they could heal or die peacefully.
Hospice care does not prolong the death of its patients. Hospice care is recommended for patients who have a serious illness and need comfort and tender loving care to recover fully.
Medicare, Medicaid, and most independent insurances provide benefits for hospice care.
There are thousands of different hospice agencies, and they continue to grow through the years.
Hospice care became a subspecialty in the medical field in the 1990s.
As these chronic illnesses prolong, the symptoms continue to get more difficult to control, so it is hospice facility and staff's job to give the patient the concept of a quality life till the end. Hospice care can manage physical symptoms for the patient, such as constant pain, but it is also about supporting the patient's family through the tragedy they have been faced with, emotional and spiritually.
Hospice care is not only for cancer patients.
Hospice care can be received by children who have terminal illnesses as well as young and older adults.
Patients and families can have hospice revoked if they feel like it's no longer needed.
While in hospice care, the patient can still see their regular physician when needed. Hospice care does not discriminate against religion, race, gender, and age, and they encourage the patients to follow their normal lifestyle and habits.
In an interview with a hospice nurse, we asked, "What does your typical workday include?" Her response was, "A typical workday includes going to my office and getting organized for the day. Then I usually visit with 4 to 6 patients. Depending on the severity of the situation depends on how long I stay in the room. Some are as short as 20 minutes or as long as 2 hours. Then I would go back to the office and finish off paperwork on the patients and return phone calls for about an hour."
Another question we asked was, what is most important to you about your job? Her response was, the most important thing to me about my job is making sure the patients were as comfortable as possible and help them have the best time they can while I'm caring for them.
We also asked, what are some of the pros and cons of working in the hospice care area? Her response was, a pro of working in the hospice care is that every action you do is the difference between comfort and pain for a patient. You are the difference between their aggravation and peace, so I would do everything I could to make a patient feel good.
We also asked, do you ever wish you could work in another part of the medical field? I have worked in many areas of nursing. However, my favorite area of nursing I've worked in has been with children in the pediatric unit. When I moved from Virginia to North Carolina, I could not find a job opening in a pediatric unit, so I took a job working in hospice care. I really enjoyed working with hospice care though. We also asked, does your job take a toll on your family and loved ones? No, my job does not take a toll on my loved ones.
When asked if you could change one thing about your job, what it would be and why, her response was, the one thing I would change about my job is adding more CNAs to do the bathing and dressing so the nurses can spend more time making sure the patient is comfortable and not in pain. We also asked, do you regret working in this part of the medical field? Her response was, I do not regret working in this field. Working in hospice care has helped me make bonds with the patients and their families. I learned that death is not a scary thing and how to help the patients make it as peaceful as possible.
We also asked, what are some of the challenges you face in your time working in the hospice/palliative care? She responded by saying, when I first started working in hospice care, I did not realize how much personal discomfort I had with death. After working at the hospice center for a couple of years, I got used to death and it did not bother me as much anymore.
Another question was, how does this job affect your day outside of it? Her response was, working in hospice care is sometimes sad when patients pass away. When working with patients, sometimes you get attached to people and it is sad when they pass, but that is just something you have to deal with when you work in this field of nursing.
Our final question was, what are your biggest struggles you face day to day with patients? Her response was, the biggest struggles I had with a patient was helping them manage their pain and helping them to cope with the whole process. Sometimes it is hard to make a patient feel comfortable and to be able to cope with their situation.
Yeah.
To make your bed up every day. Tori! No! I did it.